So welcome everybody to another episode of the Alpha Holistic Fest. I'm Dr. Jeff Feynman. That's Dr. Christina Shembro. And we are here to support you guys in your holistic choices and help you learn all the options, find out more about all the options for all of your methods of pet care, companion animal care, whether it's diet, vaccinations, treatment, behavior, anything that you want to ask us, we're here to answer for you. And Christina, how was your week? Anything exciting this week?
It seemed like just yesterday that we talked. I mean, really, I was driving home and went, it can't be Thursday already.
Yeah, it's time is going quickly, and we had a couple of gorgeous days here in Connecticut, and I barely had time to get outside. So, and
wow, yeah, got to make your outside time.
Yeah, it's got to be a priority, and again, we're constantly stressing it. It's important to realize how important getting out in the sun and the fresh air and exercise is. We as homeopaths don't necessarily lead the most healthful lives. And I know, for example, I come into the office and I'm sitting in this chair pretty much for 8 hours a day, just, talking or listening. And it's not a good thing. I just finished a book, I think I mentioned it last week, by the NASA scientist that basically tells us that sitting in a chair is pretty darn harmful to your health. And even if every 15 minutes you just get up and stretch, it's going to make a big difference. So I've been trying to institute that, but I'm not that successful.
Even while you're sitting, though, you can move your legs. You can move your legs up and down. You've got a headset on. If you're listening to a client and there's a story where you don't need to be writing, you can do finger exercises, different yoga finger exercises. So they're actually in, neck stuff. So there are things we can do even while we're sitting. But like you said, the best is to schedule yourself half an hour every 15 minutes, every 2 hours to go outside.
Yep, for sure. And my exciting news this week.
Jeff, you said you weren't going outside this last week. You have a dog, right? Don't you take your dog for walks every day? Oh no. Okay, we want to report next week, Jeff.
All right. I'm in big trouble. Yeah.
Not for you.
Everyone else, please walk your dog every day or more than that.
I have a cat, so it doesn't count. Actually, though, my cat has wanted to be walked lately, so I've been out walking my cat.
So walk on harness.
No, just we're out in the country, just on my farm, just walking around the yard.
So she doesn't run away.
Oh no.
Because certainly it's important and it's very useful to train your kitty to walk in a harness. If you can take them out, walk anywhere. Yep. So my exciting news this week is we did start to do the back end content development for the new holistic options for companion animal school that we're opening this fall. So when I say starting, the content is actually built. We were trying to load that up, and here, for anyone that wants it, that's the link to just join the mailing list for anyone that has the interest in learning more about, the options, both holistically as well as conventionally. We're going to try and blend the best of both worlds when we make a decision for our animals. And people that sign up now are going to also get to go on. We're going to have a live webinar, kind of like this, but a little more focused than this, on August 6th. The topic on August 6th is going to be specifically building vitality, and why building vitality in your animals is so important and how you can do it. And that's actually going to be what the first course is all about, is building and preserving vitality. So that's what I've been doing this week. Not been getting upstairs much before midnight.
Oh no.
So, any interesting cases or anything that you want to bring up before we talk about, other specific questions that people may have?
Actually, there is. I didn't mention it last time. I'm not sure I'd gotten the email on it yet, but hundreds of veterinarians in the UK signed a petition requesting that it become illegal in the UK for veterinarians to use homeopathy. So, I mean, I need to repeat this. There is an attempt to stop veterinarians in the UK from using homeopathy. So I put a petition link in, and if everybody goes and signs the petition, this is, you can listen to Christopher Day, who's one of the original homeopathic veterinarians, who is in the UK, and he and his wife Sheila are just wonderful people. So you can listen to a video by him, you can read about it. But it's very important that everybody interested in maintaining homeopathy for animals anywhere in the world sign this petition, because if UK goes down, then we could be next. We survived an attack from Connecticut veterinarians a couple of years ago, but we have to maintain vigilance. So that's very important.
And very, very interesting to note that attack by Connecticut, which became a nationwide EVMA attack on, sorry, I just lost my video, on homeopathy, on vet homeopathy, actually turned around 180 degrees. That attack ended up bringing homeopathy into the light, and actually the EVMA is now, very much embracing, homeopathy, or at least they're more open-minded, as Dr. Schwartz and Dr. Epstein that were at the meeting. They said that all of our conventional colleagues were very, very happy to have us join the AVMA meeting. So yeah, the person that actually brought the Connecticut, it wasn't a law, what was it? It was Connecticut requests the AVMA to ban homeopathy. Actually, Dr. Goldman is now running, or actually no, he just became an AVMA treasurer, and it's very interesting that he's moving. He's moving up in the ranks in the EVMA.
Who was that?
Dr. Arnie Goldman.
Oh, okay.
Yep. He's now. Yep. So I was gonna actually, before we brought that up, I was gonna actually see if I could play. How long is Christy's video?
I haven't actually watched it. I limit myself because I don't have Wi-Fi here.
Okay. And okay, yeah, that's not it. I'm not gonna go searching right now. But so Amelia was talking about the fact that her dog currently has Lyme disease, because I know she signed up right away when she saw that our topic, or one of our topics for today, is going to be Lyme in dogs and cats. So Amelia, if you could just type in your chat what she has no sound here. Okay, well, let me write this down. So what are the very most common symptoms, Christina, that you see in people who say their dog was diagnosed with or has Lyme disease? What is the most common?
The most common symptom is people say, my dog is absolutely fine, and there was a positive Lyme test. So that's the most common symptom. And that does not mean that they have Lyme. It just simply means that sometime in their life they were exposed to Lyme, probably within the last few months, and they were healthy enough to develop antibodies against the Lyme disease, against the Borrelia, and therefore they had the antibodies. Now, real symptoms include fever and joint pain. Those are the main things. So limping, stiffness, that kind of thing. And fever is not always there. That's more in an acute issue. So a lot of people, before we get into actually treating the Lyme, there's a lot of panic and fear and worry about Lyme, especially by clients who themselves were exposed to Lyme, and who developed Lyme and have, faced maybe years of medical challenges getting it treated. So therefore, when we talk about Lyme, the first step is to get rid of the fear of Lyme. Yes, it can be a very serious chronic disease in people. Yes, it can be an acute problem in dogs. Very rarely, it can lead to some problems that cause death. However, in general, if you're working homeopathically and holistically with your animals, there's no need to fear Lyme disease. Therefore, there's no need to fear ticks. So that's the first step, is working at getting rid of the fear of the disease in yourself. And then you move in with finding the homeopathic remedy that matches the totality of symptoms of your animal, not just now, but in the past as well. Because the only reason an animal develops symptoms of Lyme disease, actually that the Borrelia can take hold in that animal, is that something was awry before. And so that's why you want to look at all the symptoms from the very beginning. Okay, on to you, Jeff.
No problem. I
Connecticut, you're in the center of Lyme disease.
we're right down the road from Lyme, actually, Lyme, Connecticut. But I did want to go back to the beginning of why, Christina, do you think this Lyme epidemic started? Because it really was all of a sudden. I mean, I don't remember ever hearing about Lyme disease, certainly, 15, 20 years ago. Maybe there was, a few sick people, but certainly not this epidemic in dogs that we're seeing now. So, Christina, do you have any feeling for why the epidemic started? And then I'll chime in what I think might be going on.
I'm not sure. I think it probably has been around forever, and it's accounted for things that were labeled chronic fatigue syndrome, even maybe MS, some diseases that are exclusion diseases. So I think it's been around a long time. I think it has definitely increased because once we recognized it, it could have just been plateaued, but it's definitely increasing, and that's not because of increased recognition at this point. So I think the reason it's increasing is because of the general weakness of our animals and the damage that we've done to our environment and continue to do to our environment.
Yeah, and that certainly, to me, is a big cause for the increase that we've seen in the past couple of years. And not sure there actually is a disproportionate increase in Lyme disease versus all other chronic and acute diseases. Almost every year now, there's a new epidemic, new infectious disease coming on the forefront. And the reason for that is I think exactly what you said, Christina. Our level of health is going down, making our immune systems more susceptible and more open to all these diseases that have always really been around, but which we were not really, affected by. In my mind, this sudden, because it was really very sudden, I think, in a couple of years that Lyme went way up, and that sudden disease spike was actually because of the fact that all dogs, almost all dogs, when they start having the heartworm test, who were getting Lyme tests at the same time. So 80% of the dogs that were being diagnosed with Lyme were being diagnosed based on only a positive Lyme SNAP test.
Antibody.
Reality.
And so, Laura, you're right. Diagnosis is part of the cause of the spike.
I would definitely agree that was a huge part of the reason that it started to be a big recognized problem. But certainly, now we're getting to know more and more about, the acute disease and the chronic symptomatology. And and again, we're jumping ahead, but we'll talk a little bit more about, is there really such thing as chronic Lyme disease? Because that's been a huge debate among physicians for a number of years, but we'll talk about that a little bit as well. I wanted to, let me just go back here.
What Lyme disease can cause chronically?
Say it again.
Other than just the fever and arthritic symptoms, what about secondary sequelae to Lyme disease, especially some of those that are treated with doxycycline and then don't resolve? Laura was wondering about those chronic, long-term symptoms.
Yeah, I definitely want to go into the long-term symptoms, but why don't we first talk about the most common acute symptoms, because the acute supposedly should happen before the chronic. And to me, I'm going to go back 20 years before I was doing homeopathy and when I was still doing health schools. To me, the most traumatic case that accentuates the acute Lyme syndrome is Maggie, who was a happy young dog running around one day, and then she woke up and didn't want to get out of bed the next day. Didn't want to get out of bed in the morning, didn't want to eat breakfast, felt warm. The guardians didn't take a temp, but when I showed up, her temp was 103.5. And at that point, that was about the time when we were beginning to recognize more and more of this acute Lyme. The very first thing that she had at that point was an injection of penicillin. Before I left the house, that dog was up and running around again.
Wow. Yeah.
And her fever was broken. So that's one of the big hallmarks, actually one of the 3 big hallmarks of true acute Lyme disease is, well, actually 2 of the hallmarks. Number 1 is that you have the appropriate symptomatology, appropriate acute symptomatology, fever, lethargy, like Christina said, joint swelling may or may not be there, arthritic symptoms. When I had Lyme, I also had neurologic symptoms. basically, with vertigo and a lot of things that, for dogs you just recognize as an inability to do their life or have a normal life. But the most important, or one of the most important hallmarks of the acute disease is a quick, often dramatic response to drug therapy, to the antibiotics. So Maggie was an example of true acute Lyme. Her Lyme test did actually come back positive. And at that point, they were measuring antibody levels. So not just plus or minus, but 1 to 256 or 1 to 512 or 1 to 1,000. And hers was, off the scale, greater than, they could measure. So how many dogs nowadays, that's my first question, is how many dogs nowadays do we see being treated for a Lyme diagnosis that, number one, don't have any of the acute symptoms, and number two, don't really change within the first couple of days of the antibiotics, may not change for a week. And I've heard vets say, oh, it's going to probably take 2, 3, 4 weeks before you see a change. That's not Lyme disease. That's not usually, it's not acute Lyme disease. That may be a Lyme-associated disease. But then, we are getting into the fact that, that poor pup has been on now a month of antibiotics, may or may not be better, and may or may not be showing further symptomatology. I believe Amelia had said that one of the things that her dog is showing after 5 weeks of doxing is an elevation in one of the biochemical markers that we don't really associate with acute Lyme, but rather associated with dysfunction of the liver and other parts of the body. And my guess is maybe, long-term antibiotics are affecting.
I think it was high initially, though, from what she said.
Well, that was my question: is do we know what it was initially?
Her ELP is still 191, so that indicates it was up to start with.
Right, but it indicates it was elevated. But I'd be curious to know, was it elevated more than 191, less than 191? Is it going up? And was that the initial? Finding? Did the vet draw blood? That was the first thing. So, what was the very first clinical sign to Amelia? And maybe she just read that she has had very few.
191, she says, on the SLP.
Okay. So I'm not sure what you mean. So her pup was lame. Okay.
And that is frequently, people go in, my dog is lame, the vet says, well, let's test for Lyme. That's the first thing they think about, especially probably in Connecticut.
And what do you do when what do you do when your limping dog comes back positive on the SNAP test? Because around here, what people do is they start the doxycycline and they start Rimadyl at the same time.
Right.
And the dogs stop limping. So obviously, Lyme treatment did the trick.
So, anybody who's holistic, of course, would not do the doxy and would not do the Rimadyl. They would start with homeopathy or acupuncture, possibly chiropractic, although I would say really good acupuncture or really good homeopathy are the two main approaches that are most likely to deeply heal. But I would certainly just treat it as a lame dog and be looking for the totality of symptoms. If there were no symptoms at all, I might go with Dr. Steve Tobin, who's also from Connecticut, from Meriden, Connecticut. I might go with his recommendation for Lyme disease, which is to use homeopathic Lidum. So if there are no symptoms, which every once in a while, I'm stymied and I don't really find any symptoms that were there ahead of time. And all we have is a dog who doesn't feel good and is lame, and not particularly lame anywhere or anytime or no modalities. And so I may start with Lidum, but I warn people that even if the symptoms resolve quickly on Lidum, which they should do if it's Lyme disease, that we're going to need to follow up with other remedies. So we have to be carefully watching for any other symptoms. I mean, occasionally Lidum's the simillimum, but I don't think it usually is the simillimum.
Yeah, I tried very hard to make Lidum fit for many of my Lyme patients. At the beginning, I've actually never, not once, not one time, have seen Lidum actually help in a true acute Lyme. Yeah,
that's interesting. And Steve Tobin says 100% of his, and I see it help. I don't know.
But
I don't track some for sure.
Yeah, and you got to wonder what that means. 100% of sick, febrile, arthritic, limping dogs, or 100% of dogs that were diagnosed with Lyme based on, a blood test that were
symptomatic. Yeah, when you get in talk, it's symptomatic.
Yeah, so I guess maybe I'm just not doing it right. I'm just not following.
One of the things, just to step back from Lyme for a moment, one of the things about holistic medicine, and probably even in conventional medicine to some degree, is that each of us tends to need certain healers and certain types of healing. And as practitioners, we tend to attract conditions, problems, animals who need certain types, and people who need certain types of treatments. And so I remember Don Hamilton, a wonderful holistic veterinarian who wrote Homeopathic Care for Cats and Dogs. I remember him going through a phase where he said he saw lycopodium cases. It was 75% of his practice for 3 months needed lycopodium. I mean, that's like Steve, having success with Lidum all the time. And the rest of us occasionally had lycopodium. We had Peter Tobias. Almost all of his early stage hyperthyroid cats needed Natrium muriaticum and responded curatively to it. Even though he was taking the case, it always fit Nat Mir. We have Ronit from Israel, and she treated rodent ulcers, and I can't remember now, but I think it was nitric acid. And all of us have had some success with nitric acid, but she was having lots of success. So I think there is, to some degree, there's this attraction, so you're not attracting the Lidum responsive cases, and Steve is. So hard to say. Dr. Cindy Morrow, I have heard of her. She's in the Lancaster area, I believe. I just want to jot her down. I like to keep track of the holistic vets who are out there. Okay, what do you want to move on to in terms of Lyme, Jeff?
Well, I want to know what Tilla disagrees about, Becca.
Who's Tilla?
That's her. Tilla is C6 was 101 Pittsburgh.
Oh yes, I do know Cindy Morrow in Pittsburgh. She's incredible. She's got multiple practices that she runs that are holistic.
Okay. So Amelia is. The one. Yeah, so what the C6 of 101 is, is what IDEX would certainly call a positive, but, again, it's not what I would necessarily call a positive. And that, almost all of the acute Lyme cases that I've seen, we're talking 3, 4, 5, 6, 700 or higher even, with their C6 levels. And I've seen C6s of 100 that were negative on the SNAP test.
Really?
And I've seen, yeah. So, it's like Laura said before, diagnosis is both the cause and it's a big problem. As far as in people as well as in dogs, diagnosis is very, very difficult. And as I think he said earlier, Lyme is called the great imitator. It's often called the great imitator because it's also a spirochete disease similar to syphilis. Syphilis was the original great imitator. It's a disease, a sexually transmitted disease that fortunately we don't see much of nowadays. But back in the day when it was, so rampant, it would manifest in a number of ways. In fact, our homeopathic syphilitic miasm is a result of all of the syphilis that they were seeing back in the 1800s and earlier. So I forgot what, the great imitator. So certainly it being the great imitator, being called the great imitator, is one of the reasons that that almost any symptom is being called Lyme disease. And as long as it's associated with a positive SNAP test, and even sometimes when it's not associated with the positive SNAP, it'll be called and treated as Lyme disease. So, and I'm sorry, you asked something and I missed it.
No, I thought we were ready to move on to the more chronic treatment of it. But I do want to, this is just another point to remind people, and I know that most of the people who are listening right now know this, but other people listening later may not, and that is always ask, always think before you do anything that your conventional veterinarian or holistic veterinarian suggests. So if your conventional veterinarian says, oh, your dog is sick, oh, your dog has a positive Lyme, or oh, your dog has no symptoms, but there's a positive Lyme, you need to do a month of doxycycline, don't do that. You need to, you need to make up your own mind. You can always wait 24 hours. Or you can say, give me 1 day of doxycycline or 1 injection, and then I'll think about it. So you have to be in charge. You have to ask. Do not get railroaded. Over and over again, all of us as hear of people being railroaded by their veterinarians. So I know, again, those of you right now that are on are working with good vets. But for any of you who aren't, get a good vet who's open to what you want to do and open to educating you and open to explaining. They may disagree with you, and that's fine. They may be scared of a raw food diet. They may be scared not to vaccinate. That's okay if they're willing to work with you and not make you wrong for being willing to try that or go that approach. So that's important with the Lyme. This fear of Lyme we have to get rid of. Back to you, Jeff.
Well, I just want to talk a bit about what the standard of care is, because these holistic therapies, and the reason I think that a lot of the vets are going to recommend something that may or may not be what you feel in your heart you want to do, is the recommending things based on the standard of care for in this case Lyme disease. And the standard of care for almost all infectious diseases is antibiotics. So in this case, a month of doxy, 2 months of doxy, a year of doxy, a lifetime of doxy, not unusual. But Christina, do antibiotics kill or get rid of Lyme disease or any other infections?
Well, you know, when Pasteur died, as he was very ill at near death, he said, "I wish I'd never discovered bacteria. Bacteria don't cause the disease. The terrain causes the disease." And by terrain, he meant what we call vital force. He meant the vitality, the underlying health of a person or an animal. Now, does a bacteria in a susceptible person or animal actually cause illness? Yeah, I think it does. And I do know that sometimes you need antibiotics to decrease the volume when you have a huge number of bacteria present. If we were better homeopaths, we might not need that. But even a wonderful homeopath, Dr. George Guess in Charlottesville, Virginia, just brilliant, used to teach for George Patolkas, wonderful. He said that he actually discovered that when treating people with pneumonia, with severe pneumonia, not the milder cases, but when they had severe pneumonia, he needed 3 days of antibiotic and then could come in with homeopathy, and then they would recover. If he didn't do the antibiotic, it just took forever and they weren't well and it didn't go smoothly. Now, that was years ago, so he may have changed his approach, but he's said that at several different conferences. So there are times, but Lyme is a particular one where antibiotics don't seem to work very well. With people, you know, you have to go through tons of different antibiotics, and even then, the Lyme just goes and hides. The Lyme is very adaptable. The Borrelia bacteria is very adaptable, and it goes and hides, and in places the bacteria can't, the antibiotics can't get to it. So even if antibiotics have been given in the past, even if they're being given right now, you can still start in with a myriad of holistic approaches. And I do think for Lyme that homeopathy is really the best approach.
Yeah. And just going back to my question about, you know, do the antibiotics get rid of infections or like Lyme or pneumonia? And the answer is no. Now, Christina said very, very clearly exactly what the antibiotics do. They decrease the volume, the mass of the bacteria, thereby allowing the healthy immune system to eliminate the infection as best as it can. If your immune system is shot, if your immune system is not functioning properly, all the antibiotics in the world are not gonna help. And of course, you know, AIDS gave us great examples of people that had, that had total immune function failure, that were dying from simple, you know, common infections because their immune systems were not able to, you know, do their jobs. Christina, you were on the webinar last night. Did you catch the slide that Henrietta put up about mastitis? Mastitis is, you know, and frequently bacterial infection of the udder of cows, and it's a huge problem in dairy production. But I was shocked. I mean, I actually had to make a screenshot and plan on reproducing this quote from a university professor with a PhD who knows what he's talking about. He's a veterinary specialist that basically said it is, quote unquote, it is the immune system of the dairy animal that eliminates infectious organisms. Non-responsive cases of infectious disease need to be recognized as failures of the immune system. So what that says to me is what we need to be doing better jobs at doing is building up the immune system and doing what we're talking about here, and which all of you guys already are doing, which is fostering healthier and stronger vitality in all of our animals.
Now, on the other hand, as Laura asked about, well, wouldn't the immune system already be compromised if for a dog to get Lyme disease? That's true, but we may not do it. We may have been doing the best we could for a particular animal, but remember what I'm always doing. Each animal is born with a unique vital force that is sensitive to different things. So while all dogs and cats and people may be slightly sensitive to Borrelia and developing symptoms, some, otherwise healthy, have a really deep-seated genetic, epigenetic sensitivity to Lyme. So an apparently healthy dog could then come up with Lyme disease symptoms. Now, those dogs or cats or people should respond much more quickly to homeopathic treatment than ones with weakened immune system. But it's not saying 100% that the compromised immune, that, because some people that I've worked with, we've done our best. They're on a fresh food diet. We've done muscle testing to see what's the best food for them. They're getting a lot of variety. It's local. The people don't smoke. There are no toxins around. They're not vaccinating. They could be. I worked with a dog that was 10th generation, never vaccinated, including for rabies for 10 generations. And these dogs have come down with wobbler. They've come down with one was blind. So they do have issues, even generations down the line. And Pottinger's cat study, it took 3 generations. After 1 generation of feeding cooked meat or milk, it took 3 generations to get back to health again. So, it takes a long time. The best we can do to build the immune system with homeopathy and everything else we've been talking about here, you still might get sick. We're not saying it's magic. It's just we do the best we can with everything that we keep learning. And we keep learning new things, for sure.
And, I think that there are two points that Laura made that are real important. And I think, Laura, the first answer to your question about, the tick diseases, sometimes we don't have enough time to build up the immune system with homeopathy. Let's look back to the 1800s. Let's look back to the pre-antibiotic time in medicine. Pneumonia was rampant. People with pneumonia, different kinds of flus, plagues, fatal diseases, typhoid. There were epidemics, things that were cholera, things that were killing 70, 80, 90% of the people were dying with these diseases. But some of the expert homeopaths back then were losing a zero. We're talking about the difference between 80% mortality and 0 to 1% mortality in some cases. Now, I don't know that antibiotics are going to be able to do a better job than that. The big difference nowadays is not in our levels of health necessarily, not necessarily in the state of the environment. The big difference is really, I think, in the quality of the education of a lot of the practitioners that we say. There aren't that many people, whether it's MDs or veterinarians, but there are not a lot of people that are educated in homeopathy the way they were back in the 1800s, when they would be able to go to homeopathic medical school and hone their skills for years and years and years before graduating to treat their patients. So I think that if one of my patients is not getting better with homeopathic treatment, it's not a failure of homeopathy. It's a failure of me.
Right.
And the first thing I'll do is I'll refer them to Christina.
And I do the same, right back to Jeff. Going to someone else.
Now we're both in a lot of trouble. Yes, somebody else. Yep, for sure.
So another thing that Laura brought up is there's a distinction here, Laura. We're talking about building the immune system. Now, when we say that, what we mean is the vital force, the energy field that runs the body, is very, very mobile or flexible, changeable. So when it is susceptible to an organism, it goes into alert of producing symptoms. When it's in this heightened state, homeopathic remedy can, when we find the match of a homeopathic remedy, it's going to very quickly get rid of that infection that came in, get rid of the current illness, get rid of the pain. Somebody who's broken an ankle will take arnica or symphytum, and maybe in a week they're walking again instead of 4 or 5 weeks. So the acute part is fixed right away. Then we have to work at fixing the susceptibility, and that's building the immune system. So if there's poor diet, they're going to be weaker overall, so the susceptibility is going to be bigger. If they're on, so if you can build up their general health, the susceptibility will not be quite as bad, usually. As I said, there's sometimes exceptions. And homeopathy can also help rebalance that, therefore building up the immune system. So no, you do not need to start with doxycycline first and then go to homeopathy. You can homeopathically treat the current symptoms with a few hints from the past and resolve what's going on currently, and then continue to build, to restore the vital force to balance / build up the immune system.
So when people say, oh, we can't use homeopathy because it doesn't work fast enough or it's slow acting, Christina just helped dispel that myth. I'll give you a good example similar to what Christina just mentioned with the dog that came up acutely lame. This was the dog, Cheers, actually. Cheers had been on steroids for months and months and months before my clients adopted her. And we spent months and months getting off steroids, and she's doing great off the steroids. But then they started training her for agility. Well, one day she came up horribly lame in a leg after agility. There was no injury, but she was very, very lame, went to the vet, diagnosed by snap test as Lyme disease. Did not use doxycycline, treated basically the dog with homeopathy for about 24 hours. At that point, she was a little better, but still not right. Went back to the vet the next day. The vet said, oh, must be a blown ACL, torn cruciate ligament. So they took x-rays, and they diagnosed for sure a torn cruciate, said her agility career is over. She went home with some new info, with a new consultation. She was given a new series of, actually one homeopathic remedy, but it was repeated a few times. By the next day, she was totally sound, back to herself, and I just spoke with Patty last night. She's doing great. So I guess the dog really had Lyme disease and a torn cruciate, right? And that went away in 24 hours.
4 hours. That is gorgeous, Jeff. Absolutely.
Yes. Yeah. And I think the only reason that we're able to even see such a great response is because, the guardian of these dogs basically only uses homeopathy to treat if their dog feeds a raw diet, doesn't vaccinate except for rabies as required by law. And even the rabies, she only approaches in the correct situation, meaning that she won't do a rabies vaccine if there's any of the common but abnormal symptoms present, because she knows that there's still an internal energetic imbalance that needs to be corrected with homeopathy before the rabies vaccine, because that's when you can see, really bad outcomes after vaccination. Those can be the dogs that can get the rabies miasm and get really sick after the vaccine, as if they're already sick or imbalanced before the vaccine. So sorry for that version there. Anyway,
I'm not sure Hahnemann really said you can't treat a dead patient.
Yeah, never saw that.
Hahnemann didn't mean that you should use conventional first. Definitely, as I talked about with pneumonia, there are times where you may need to use something conventional. Absolutely, you may need to do fluids. You may need to do blood transfusion. There are things that you may need to do. It is integrative medicine, and I'm so sorry that you lost your dog to Babesia. And we'd have to talk more, we'd have to have a conversation about why, what happened and what the progress was and that type of thing. And as Jeff said, we're not always successful with homeopathy. And there are times where other approaches need to be done. People who are wonderful traditional Chinese veterinary medicine practitioners are often successful, and other times they're not successful. So, and even if Hahnemann said you can't treat a dead patient, I'd have to look at the context at which he was saying that. I mean, certainly if a dog has been poisoned, I'm going to want to use the appropriate, I'm going to give some vitamin K if it was warfarin and homeopathic treatment at the same time. If there was something where you needed to get it out of their body, that the appropriate treatment was an emetic, then you're going to give hydrogen peroxide and get it out of the body. So there definitely are times, where you don't come in just with homeopathy, although homeopathy could probably cure that and treat that. But these days, we're not, as Jeff said, we're not that well trained in treating those types of problems. So there are certainly times where you need to come in, but people say, when do I need to not do homeopathy and when do I need to go to the vet? And each one of us gives different answers to that. And the bottom line is really what you're comfortable with. And so, again, if it was a dog with antifreeze poisoning, you'd want to be doing homeopathy as well as conventional treatment because it so quickly, goes to the kidney. So, yeah, you're absolutely right. There are times, Laura, where you need to come in with emergency treatments. I've never treated Babesia, Jeff, other than cases that had been very, very chronic and treated for years conventionally, and I was basically just treating chronic disease. Have you ever treated an acute Babesia?
A few, and I don't share Laura's experience. However, it doesn't really matter because I agree with Laura 100% that if it's any fast-acting, serious, or disease that we know is going to respond to a conventional drug, I agree, Laura, 100%. Go right in and treat them right away. If you're going to save a dog in the next 12, 24 hours by using your conventional treatments, then go right ahead and do that and follow up, as you said, with homeopathy at that point, because you've gotten rid of the acute disease, but the susceptibility that caused the underlying problem, the bigger problem that caused or allowed that acute disease to emerge, that is not only not being addressed with the acute treatment, but there's very good evidence that the acute treatment is making you more susceptible to more diseases later on. And in fact, when we get back to, we're going to circle around to chronic Lyme symptoms.
Actually, there's only 4 left.
Well, I was going to say, that's why I wanted to do it now, because I do not want to forget this great new information that they're finding about chronic Lyme. And it's turning out that chronic Lyme is almost certainly a result, if not a total cause and effect, from a dysbiosis in the body. And it's a dysbiosis caused by chronic long-term antibiotics. So it's a real catch-22. The more antibiotics you take, the more susceptible you are to further diseases. And that's why Patty and Cheers were able to so quickly, get rid of the acute lameness that the pup had. And Judy is going to say, but what about Lola? Lola's never had any long-term drug treatment, but she's having her pups go on and on. And that's because, Judy, there's likely a much more serious physical problem going on with Lola. And like Kate said, it is all very complicated. We do need to look at everything holistically, whether it's a large number of bacteria overwhelming an already healthy immune system, or is it a small bacterial load causing symptoms in an already sick dog? Is it a structural problem? Is it a functional problem? But that's why we have homeopathic and holistic veterinarians that have been trained with all the conventional tools and conventional information that every veterinarian has available to them. But we have so much more in that we're open-minded. And, as Christina has brought up over and over again, you need to use what works for you as an individual, whether you're the veterinarian or the guardian of the animal. And Christina, I'm sorry to rant with only 1 minute to go, because I know we'd like to try and end on a more upbeat note. So let's get upbeat.
I think one of the upbeat notes is Judy said it's so complicated. And that's why you want to really have a relationship with a veterinarian who you feel really comfortable with. So when you're working with Dr. Morrow, Laura, you can say, you're working with her and saying, what else can we do? And why would that work? And you can call her if there's, problems and things aren't resolving. You can call her and say, hey, wait a minute, what can we do now? What's going on? And our training gives us, it's not just our training, it's actually the fact, and this is true for conventional veterinarians as well, when you see things over and over and over and over and over and over again, then you get more expert at learning what's good and what's not good. So the good news is there are well-trained holistic and conventional veterinarians who can hold your hand and partner with you. Not hold your hand like I'm taking care of you, but hold your hand like a partner. And the two of you together can discover what's the best approach. And health is a journey. It's not a place we get to. So we get better, worse, better, worse, better, 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 hopefully. But it's not something that's quick. It's not necessarily. It's like the good news is this is an ongoing life experiment, excitement, adventure. So have fun with it. Enjoy it. Don't get too tied up. We all are going to die. All of our animals are going to die. So enjoy every moment. Be joyful in all as much as you can, even when when they or you are really ill. Look for the joy. Look for something new every day to be grateful for. And I'm grateful for organizing and hosting and doing all the technical stuff with this, so I can just show up like I love to do.
Well, yeah, that's great. Thank you all for coming. And as Christina said so beautifully and eloquently, which I could never do, we all need to get outside. We all need to get and enjoy the sun and move and live healthful lives and be positive and expect the best. And the best will come to all of us. So thank you all for coming. Any final questions that you want to ask?
So I'm going to let you finish up.
What I was going to say is, any final questions that anyone wants to ask, just go ahead and put them in the chat. I will put the link again for the new Holistic Options School that we're starting in the fall. And thank you again, and be well. Bye-bye.